Good afternoon. I'm Tim Baroody, City Manager, City of Fredericksburg. Again, here with you today to offer some updates as it relates to our COVID-19 actions in the city. I'm happy that Kerry Devine, Councilwoman Kerry Devine, could be with us. She's offering some advice, some check-in with our residents, and she'll do that remotely, again, leading by example from home. Happy to have her with us again. Also, we have Chief Jones to again update on numbers and other pieces of advice for our residents, our businesses. Please heed this advice. It's important that we all stick together in this crisis mode while we work to flatten the curve. Thank you.
Hello, this is Kerry Devine, Fredericksburg City Council member at large, and I'm here today to talk to you from my front porch, staying at home like many of you are. City staff is working in teams these days to provide safety for them and to make sure all of our city needs are met. If you have a concern, please email or phone them, but allow for extra time for them to get back to you. We'll be conducting a virtual meeting today at 4 p.m. to address some immediate government actions as they relate to COVID-19 virus. These actions aim to give assistance to our businesses through grants and extending deadlines on various taxes. Please view live at 4 p.m. or recorded from our website or Facebook channel and government channels. Our April 14th meeting will also be virtual. The budget public hearing process will be different. Those guidelines will be approved today. Please patronize our local small businesses. I applaud their innovation and determination as they face the challenges of today. Please order takeout or delivery options if those are available. Buy gift cards to ensure cash flow. Order online locally. I'm doing my part. Most days I'm minding grandkids so that my son, who's a firefighter, and my daughter-in-law, who's a physical therapist at the hospital here, can stay working for all of us. I'm also teaching from home. I'm ordering takeout. I'm buying gift cards, and I'm sewing face masks for school food distribution volunteers, for hospice, and hospital staff. So if you can sew or can wield a pair of scissors, please consider helping to meet Mary Washington Healthcare's 5,000 mask challenge. Please continue to check on neighbors, especially those living alone. Give them a call so they hear a live voice. That personal connection is so important. Step outside and say hello at 6 p.m. every day. And if you must go out for an errand or get groceries, please check to see if you can pick up necessities for a neighbor. So stay home, stay connected, stay well, and stay Fredericksburg strong. Thank you.
Mike Jones, Fire Chief, City of Fredericksburg. Let's give you the latest statistics on the COVID-19 crisis. As of noon today, there were 367,776 cases of COVID-19 in the United States, and the death toll now stands at almost 11,000 people. In Virginia, we've been ramping up our testing. We've now tested over 28,600 people. We have 3,333 presumptive positive cases, resulting in 563 hospitalizations and unfortunately 63 deaths throughout the state. In the health district, we've increased 8 cases since yesterday. We now have a total of 93 cases, 46 in Stafford, 27 in Spotsylvania, 9 in King George, another positive case identified in the city of Fredericksburg for a total of 9 there, and 2 in Caroline County. We still stand with only 2 deaths in the entire health district from COVID-19. Even though city offices are closed to the public, your city government is here for you. We still have limited staff working in our offices, but we have more people working from home and doing telework, and we can handle your needs in a timely fashion. If you have the availability, electronic means works best now. Let's talk about some reminders for our city residents. First, practice good hand washing techniques. Use soap and warm water and scrub for at least 20 seconds. Stay at home and self-isolate from others in your family if you're sick. Cover your cough and sneeze. If you have mild symptoms, you may be able to use telemedicine. That's becoming very popular now. Some doctors' offices and even your health insurance carriers oftentimes offer that option. Check it out and see if it's available to you. We can't emphasize this enough. Keep the wipes out of the pipes. That's right, only flush toilet tissue. Do not flush wipes, paper towels, or other products. They can clog the sanitary sewer system and may even damage the pipes from your house to the street, which can be an expensive repair. Keep any travel to essential only. Get groceries, medicines, takeout food, etc. Go less often and combine stops so you only have to go but one time. Don't forget about your absentee ballot for the May 5th election for local officials. Make sure your pets are taken care of properly and have a plan for them if you become sick. Develop your medical history and medicine log now. Have that available in several copies in case you have to go to the ER. When you're practicing social distancing, again, the important reminders of using the 6-foot distance from other individuals to keep the spread down. If you're sick, please isolate from others and adhere to the recommended guidelines about distancing and quarantining yourselves from others until the illness is passed. And if you're practicing in groups of less than 10, which is great, just make sure that you keep the groups similar as you go through rather than changing groups time after time. If you have mental health or stress release, you can try these numbers: 1-800-985-5990, or if you want to, you can text "Talk with Us" to 66746, or visit www.disasterddistress.samhsa.gov. That's brought to you by the Substance Abuse and Mental Health Services Administration of the U.S. government. Remember to keep up those personal hygiene and social distancing habits. Thank you.